Hi, this is Susana Arciga, physical therapist at the Marquette University Clinic. And now with Kevin, we will be reviewing a side lying position for sleep. However, this is a little bit different. It has kind of the leg propped up, which is very common, I find, in some patients. And it requires a different use of pillow support. So why don't you go ahead, so kind of getting down onto your side. Okay. So now with him, yep, so this is how he normally would kind of sleep. And that's a very common position I kind of find is told to me by my patients. And so with this, I tell them that there's still support to be had. Usually I will ask patients to have more of a king size pillow or a body pillow. Just, it would have to be more firm, and the body pillow, if possible, a little bit more flat-like versus round. Because a body pillow would actually be very good for this position, because then he could kind of hug it with his top arm too. But for our purposes today, I will show how to support the lower half. And so we pre-measured this, so unfortunately I have to use 3 clinic pillows just because they're very fluffy. However, at home I recommend just getting one good king size pillow. Get one that's fairly firm, because there's quite a bit of distance from the bed up to the height of the thigh. So what I'm looking for with this, it's similar to the other side lying position, is that this thigh is well supported. So with Kevin here, what I did is I kind of really tucked this in as close to the groin area as comfortably possible to just truly support him. It's supporting his thigh. His knee is about the level of his hip, actually just a hair lower, just to keep a little bit more with the natural alignment of our bodies. And then I'm supporting his leg. He can kind of prop it up, whatever feels comfortable. Now with Kevin here, I would prefer to have a king size pillow, and with the goal that his whole foot is supported. Because that will make a big difference, especially if you're experiencing some sciatica or some low back or SI issues, or just even some hip issues. This can really take the strain away from the hip. You can see here just how much it does drop. It doesn't seem like much, but Kevin, does that feel different if I support your leg here?
Yeah, definitely.
Okay. And so with this, it may not seem like a lot, but just that little bit of a drag by gravity is enough to irritate an injury throughout the night if you have one, which can create some soreness or kind of achiness, stiffness in the morning. So this is really helpful, even if you don't have an injury, just to get used to having some type of support to minimize your risk of injury down the road. And I think that will do it.